KPRC2 is your vaccine central. On Saturday, the CDC approved the COVID-19 vaccine for children 6 months to 5 years old, but some parents may still be on the fence to get their child vaccinated. Joining us this morning to discuss this is Dr. Kristina Bryant, pediatric infectious disease specialist at Norton's Children's Hospital. Good morning. Thank you so much for joining us.
Good morning.
So we've seen this situation with the pandemic kind of ebb and flow. Given where we are now with the COVID-19 pandemic, would you say it's important for parents to get their children vaccinated and boosted?
Absolutely. So what we know is that COVID-19 can be a serious illness in young children. The idea that it's no big deal is really kind of a myth. Since the start of the pandemic, there have been more than 2.5 million cases in kids between 6 months and 4 years of age, and 20,000 hospitalizations. Half of those hospitalizations have been in kids who are otherwise healthy. They don't have any chronic medical conditions. And so it's just really hard to predict who is going to get sick from COVID. We even have deaths in young children. There have been 200 deaths so far in kids 6 months to 4 years of age. So prevention remains really important.
Give us a quick rundown here. Who is currently eligible to get vaccinated and boosted?
So everyone in the U.S. 6 months of age and older is eligible to be vaccinated. Boosters are currently recommended for those 5 and older.
So if a child has had COVID, do they still need to get vaccinated?
They do. Now, maybe not right away. The CDC says minimally wait until you're recovered from COVID-19, but you might consider waiting up to 3 months because reinfection within that first 3 months is pretty uncommon. You've got a strong immune response, but after that, it starts to wane, and we know that people can be reinfected. There was a study done right here in Kentucky in adults. Adults who had COVID and then got vaccinated were half as likely to get COVID again. We think that'll be the same for children.
And I know we get this question a lot from parents. They want to know, what risk does a COVID vaccine carry in children compared to the risk from a COVID infection?
Oh, the COVID infection carries a lot more risk. So the vaccines that are available for children have been studied intensively for safety. In general, kids tend to have fewer side effects than adults. And the effects that we see after COVID-19 vaccine are pretty similar to what we see with other routine childhood vaccines. Sore arm or leg where the shot goes in, maybe some redness and swelling. Some kids will develop fever. It lasts a day or two if it occurs. Some kids might develop swollen lymph nodes, feel tired, fatigued, but they recover quickly. That's not always the case with COVID-19, as you know.
Right, and many parts of the country have seen an uptick in cases. So what do people need to understand about the possibility of new variants or subvariants?
So as long as COVID-19 is circulating, we are likely to see new variants. And so it is very important for people to protect themselves. Even people who live in communities where there's not a lot of COVID-19 right now, it is likely that numbers will tick up in the future. And so now's a good time to protect your kids.
And what about the current vaccines? Are they going to be effective against these new variants and subvariants?
The vaccines have been effective against all of the variants and subvariants so far. Most importantly, they protect against serious illness and death, and that's really what we want to do.
Paint a picture here for us. What does the future look like with COVID? Will we need to get a vaccine and boosters every year just like we do with the flu shots?
Well, that's a great question. We don't know yet. I suspect that may be in our future, but public health experts will tell us if that's necessary.
Well, we certainly appreciate your insight this morning. A big thank you, Dr. Kristina Bryant, pediatric infectious disease specialist at Norton Children's Hospital. Have yourself a great day.
Thanks, you too.